You're watching it, waiting. But a wound that won't heal is your body sending a clear signal. But what if it's not just stuck? What if that wound is actually getting bigger? Most minor wounds show clear signs of closing within 1 to 2 weeks. But when weeks pass with no change, this is more than slow healing. It's a chronic wound. We'll show you the visible symptoms to watch for, the hidden causes, and when you must act. Medically, a wound is classified as chronic if it hasn't healed in 3 to 4 weeks. This is a clinical benchmark. The first signs are persistent redness, swelling, and tenderness. The difference is they don't go away. If that redness lasts beyond a week or two, it signals chronic inflammation or infection, both of which block healing. Pain should decrease as a wound mends. If your pain stays the same or gets worse, it is a major red flag. Watch for any fluid. Continuous pus, blood, or discharge with a foul odor strongly indicates an infection. You can see the signs, but what is happening underneath the skin? Why is your body struggling to heal? Healing requires a delivery service. Your blood brings oxygen and nutrients. Without good circulation, the repair crew never arrives. A primary cause is peripheral artery disease. Plaque builds up in arteries, narrowing the highway for blood flow. This explains why these wounds are so frequent on legs and feet. They are furthest from the heart and most vulnerable. A wound starved of blood will often look dry, pale, and discolored. It lacks the vibrant red of healthy tissue. Even with good blood flow, an infection can hijack the healing process. Bacteria prevent new tissue from forming. But what if the problem is not just blocked pipes or invaders? What happens when your body's chemistry works against it? This is the reality for millions with diabetes. High blood sugar is not just a number. It actively damages your body's repair systems. First, it causes nerve damage, especially in the feet. A small cut might go completely unnoticed, giving the wound a major disadvantage. Second, high blood sugar impairs your immune cells. The cells meant to fight infection become slow and ineffective. Critically, diabetes also damages blood vessels, often causing poor circulation. This creates a dual threat: nerve damage plus restricted blood flow. We've seen how circulation, infection, and diabetes can sabotage healing. Do any of these apply to you or a loved one? It is rarely just one cause. Several risk factors can stack the deck against your body's ability to heal. Age is a major factor. As we get older, our skin is more fragile and circulation naturally declines, slowing resource delivery. Obesity and high blood pressure also strain your vascular system, which further impairs blood flow and the healing response. Finally, any condition that weakens your immune system leaves you more susceptible to infections that halt healing. With all these factors in play, how do they combine to produce the most severe outcomes? Let's connect the dots. Remember the circulation issues from PAD and the nerve damage from diabetes? When a patient has both, it creates a devastating cycle. A person with diabetes may not feel a foot injury. Poor circulation then stops healing resources from reaching the site, and the weak immune system cannot fight infection. This leads to the most serious visual sign: necrosis, or dead tissue. Starved of blood and overcome by infection, the tissue simply dies. This dead tissue can appear black, brown, or yellow. It physically blocks new growth. This is how a wound can literally grow larger. Let's review. A wound that fails to improve in 2 to 3 weeks. Persistent pain and redness. Foul-smelling discharge, and, most critically, dead tissue. These are not surface problems. They point to deeper issues like poor circulation, diabetes, or infection. Sometimes this can cause systemic symptoms like a fever. Knowing these symptoms and causes is the first and most powerful step to taking control. Your body is signaling that it needs help. If you recognize these signs in yourself or a loved one, do not wait. Contact a healthcare professional. It is the most important step you can take.